Have you ever wondered why some people begin developing dementia even though they never seem forgetful at first? Most people believe memory loss is always the first warning sign, but that isn't what doctors often notice in the earliest stages. In fact, one subtle change can appear months, or even years, before serious memory problems begin. Because it seems so ordinary, families often mistake it for stress, aging, or simply having a bad day. By the end of this video, you'll understand what that early warning sign is, why it happens, and what you can do to protect your brain. Make sure you stay until the end, because one simple daily habit could make a meaningful difference for your long-term brain health. Hello, I'm Dr. Ethan Carter, and welcome back. Dementia doesn't happen overnight. It develops gradually as changes occur inside the brain over many years. While memory loss is one of the most recognized symptoms, research has shown that the earliest clues are often much more subtle. Many people continue driving, cooking, working, and carrying on normal conversations, while these hidden changes quietly progress. That's exactly why recognizing them early is so important. Early evaluation doesn't cure dementia, but it can help identify treatable causes of symptoms, support better planning, and in some cases allow treatments and lifestyle changes that may slow decline or improve quality of life. Imagine meeting a friend you've known for years. They remember your name, recognize your face, and recall stories from the past. Everything seems perfectly normal. But during the conversation, something feels different. They struggle to plan what they want to say, lose interest in topics they once loved, or seem unusually withdrawn. These changes are easy to dismiss, yet they may represent one of the earliest signs that something inside the brain is changing. One of the first changes many specialists look for is difficulty with executive function. Executive function is the brain's ability to organize, plan, make decisions, solve problems, and manage everyday tasks. Think of it as the brain's management system. When this system begins to weaken, simple activities suddenly become more challenging. Someone may have trouble following a recipe they've cooked for years, paying bills on time, organizing a shopping trip, or keeping track of appointments. These aren't simply signs of getting older. They can sometimes indicate that important brain networks are under stress. Here's why this matters. Healthy aging can slow us down a little. We may occasionally forget where we left our glasses, or need an extra moment to remember a name. Usually, the information comes back later. Dementia is different. It gradually interferes with thinking skills in ways that affect daily life. The difference isn't one forgotten detail. It's a growing difficulty managing everyday responsibilities that were once routine. Families often notice personality changes before they notice memory changes. A cheerful person may become unusually irritable. Someone who loved social gatherings may begin avoiding friends and family. Others lose motivation for hobbies they once enjoyed every week. These changes can happen because different parts of the brain control emotions, judgment, and behavior. When those areas begin changing, the person's reactions can change as well. Another early clue is poor judgment. Someone who has always managed money carefully may suddenly make unusual purchases or fall for scams. They may ignore bills, forget to renew insurance, or trust strangers too easily. Loved ones sometimes assume the person is simply distracted, but repeated changes in judgment deserve medical attention. The earlier these concerns are discussed with a healthcare professional, the better. Sleep may also provide important clues. Many people think poor sleep only causes tiredness, but the relationship works both ways. Changes in brain health can affect sleep, and poor sleep may also contribute to cognitive problems over time. If someone begins acting out dreams, sleeping excessively during the day, or experiencing significant changes in their sleep pattern along with thinking difficulties, it should never be ignored. One question I hear frequently is, can stress cause these symptoms? The answer is yes. Stress, anxiety, depression, vitamin deficiencies, thyroid disorders, medication side effects, and several other medical conditions can all affect memory and thinking. That's why self-diagnosing is never a good idea. A proper medical evaluation is essential because some causes of cognitive symptoms are treatable. Assuming it's just dementia without an assessment could mean missing a condition that can improve with the right care. Let's talk about brain health. Your brain depends on healthy blood flow, quality sleep, regular physical activity, balanced nutrition, social interaction, and lifelong learning. When these habits decline over time, the brain becomes more vulnerable. This doesn't mean a healthy lifestyle guarantees you will never develop dementia. It does mean that taking care of your heart, blood vessels, sleep, and overall health also supports your brain. One of the biggest mistakes people make is waiting until memory loss becomes obvious before seeking help. By that stage, changes inside the brain may already be well established. If you or someone you love develops noticeable changes in planning, decision-making, behavior, personality, or daily functioning, don't ignore them simply because memory still seems normal. Those early changes deserve attention. Now, let's continue with the warning signs that many people overlook. Another early change can be difficulty finding the right words during everyday conversations. Almost everyone occasionally forgets a name or pauses to remember a word, and that's completely normal. However, when someone repeatedly struggles to express simple thoughts, substitutes incorrect words, or frequently loses track of what they are saying, it may signal changes in the parts of the brain responsible for language. Family members often notice these changes long before the person notices them themselves. Another subtle sign is becoming confused in familiar places. Imagine driving to the grocery store you visited for years, but suddenly feeling uncertain about which turn to take. Or walking through a neighborhood you've known for decades and briefly forgetting where you are. While everyone can become distracted occasionally, repeated episodes of disorientation should never be ignored. They may indicate that the brain is having difficulty processing spatial information. Many people are surprised to learn that changes in vision can also be connected to dementia. This doesn't necessarily mean blurry eyesight. Instead, the brain may have trouble judging distances, recognizing objects, or interpreting what the eyes are seeing. A person may suddenly have difficulty parking a car, pouring water into a glass without spilling it, or recognizing familiar faces from a distance. Because people often blame these problems on their eyes, they may never realize the brain could be involved. Another important warning sign is withdrawing from everyday activities. A person who once loved meeting friends, attending family gatherings, or participating in community events may gradually stop going altogether. Sometimes this happens because they feel embarrassed by the changes they are experiencing. Other times, the brain simply finds social situations more difficult to process. Family members may think the person is just becoming quieter with age, but this loss of interest deserves attention if it continues. Who is most at risk? Age remains the biggest risk factor, especially after the age of 65. However, dementia is not a normal part of aging. Many older adults never develop it. Certain health conditions, including high blood pressure, diabetes, obesity, smoking, untreated hearing loss, poor sleep, and lack of physical activity, can increase the risk over time. Having one or more of these risk factors does not mean someone will definitely develop dementia, but improving them may help reduce the risk and support overall brain health. The good news is that your brain is more adaptable than many people realize. Scientists call this brain reserve or cognitive reserve. Every time you challenge your mind by learning something new, reading, solving puzzles, staying socially connected, exercising regularly, or eating a balanced diet, you are supporting your brain's ability to function well as you age. These habits cannot guarantee prevention, but they are among the best evidence-based steps you can take for long-term brain health. Physical exercise deserves special attention because it improves blood flow throughout the body, including the brain. Even a brisk 30-minute walk most days of the week can benefit cardiovascular health, which is closely linked to brain health. Strength training, balance exercises, and stretching also help people remain active and independent as they grow older. Always speak with your healthcare provider before starting a new exercise program, especially if you have existing medical conditions. Nutrition also plays a major role. A diet rich in vegetables, fruits, whole grains, beans, fish, nuts, olive oil, and healthy fats has been associated with better brain health in many studies. At the same time, reducing highly processed foods, sugary drinks, and excessive alcohol may support overall health. Think of food as fuel not only for your body, but also for your brain. Sleep is another powerful tool that is often underestimated. During deep sleep, the brain performs important housekeeping functions, helping clear away waste products that build up throughout the day. Chronic sleep deprivation may interfere with these natural processes. If you regularly snore loudly, wake up gasping for air, or feel exhausted despite sleeping through the night, talk to a healthcare professional because conditions like sleep apnea can affect both heart and brain health. Perhaps the most important message I want you to remember today is this: early action matters. If you notice ongoing changes in thinking, behavior, planning, language, or personality, whether in yourself or someone you love, don't assume it's simply old age. Schedule an appointment with a qualified healthcare professional for a complete evaluation. Early assessment can identify treatable conditions, provide support, and help families plan for the future. If you found today's information helpful, share this video with someone you care about. One conversation could encourage a friend, parent, or loved one to seek help sooner rather than later. And if you're interested in learning more about protecting your brain, healthy aging, and the latest evidence-based health advice, subscribe and join me for future videos. I'm Dr. Ethan Carter, and my goal is to help you make informed decisions so you can live a healthier, stronger, and longer life. Thank you for watching, and I'll see you in the next video.